fuck the pharmaceutical companies and fuck the government, and this is how we're helping people who are in our community, and we will overgrow them eventually.
Hi, I'm Steve with wearechangect, Connecticut, and I'm here with Glenn Peterson from Canuvo
Dispensary in Biddeford, Maine.
Glenn, tell people what you do.
I have one of the 8 licenses issued in the state of Maine to have a dispensary and produce as much cannabis for my patients as necessary. So I have hundreds and hundreds of patients that I see each week and get them switched over from pharmaceuticals or whatever their needs are to a cannabis-based therapy.
We're here with Rachel Gerlach, one of Glenn's patients who was able to use medicinal cannabis to detox off of Oxycontins. True life story for those people who say that this doesn't work, the people just are using it just to get high. We got a real live case right here, a true life story. And for all you saying that, oh no, she's just a junkie who was getting high, no.
As a medical cannabis patient, it's absolutely changed my life. I became a medical cannabis patient in February of this past year. And while I've used cannabis in the past, I never used it medicinally like I did in the past year. The results have been literally life-changing. And anybody who has issues dealing with certain chronic pain, I would highly recommend that they at least educate themselves on the topic. When I started medical cannabis, I had a herniated disc in my lower back. I'd been dealing with it for 2 years, and my doctor had me bouncing between oxycodones, Oxycontin, and hydrocodone. The reason I bounced between the bunch is because I was a little concerned about the addictive quality of the pharmaceuticals, and rightly so. I've seen many addicts to pills that have been in my lifetime that have been really bad. So what I did was I tried to get my doctor to give me something that wasn't addictive, that would target the pain the way the Oxy and the Hydros did, and she had nothing literally for me. She had to keep me on the Oxys or let me be in chronic pain. And I said, thank you kindly. I will take my own well-being and health care into my own hands, even if I have to take it on the streets. And so I stopped Oxy and Hydro at that time. At that point, I was very much overweight. I was very depressed. I had literally gained a ton of pounds, and I went from an insomniac to a raging insomniac.
So what is the basic regimen that you provide to get people off of like oxycodones and the other dangerous pharmaceuticals out there?
Well, we have found that our tinctures, which we concentrate the cannabinoids from the plant, is very effective in getting folks off of Oxycontins. The cannabinoids, it is sort of like the sailors that went to sea in the 18th century and they came down with scurvy. They lacked vitamin C and orange in their diet. We've been denied this plant for 80 years, and we have receptors in our brains, our stomachs, our intestines for this plant, and we're just allowing folks to be reintroduced and incorporated into their health regime. And one of the things we're very effective on is getting folks off of Oxycontin. And in a very short time, in the matter of 10 weeks, we can wean people off and substitute our tinctures for the Oxycontins.
Now, you say you use tinctures. Can you explain to our viewers the difference between tinctures and other forms of medical cannabis?
Well, we talk in terms of delivery systems, that you can smoke the plant and have an immediate effect, but it's a pretty wasteful process. Any smoke you see dissipating from the bowl or from your mouth, from your lungs, is wasted medicine. So we often try and get people to vaporize their cannabis if they like to smoke. If not, we we do a concentration process. We either do a wet wash on the leaves and harvest all the trichome resin balls and then concentrate that into grain alcohol, or we dry it and then put it into coconut oil and then capsulize it for folks so they can do an oral dose. But it's getting the cannabinoids into their system in one way or the other through droppers or edibles. We make a lot of either little chocolate coins or different sweets that contain the cannabinoid extracts.
In February, I became a medical patient and I learned about the wonderful benefits of tincture. And every day, I learned to regulate my dosage on tincture. And every day I started taking the tincture as a regular dosage like I would in place of the Oxy. Within 2 weeks, I was off the pharmaceuticals completely. I had started to sleep better. I had started to feel better. The chronic pain was regulated better than it was with the pharmaceutical drugs. So I fast forwarded about another couple months on this regimen. And as I did, I continued to increase my ability to be effective during the day. My energy levels went up. My activity went up. I started losing weight. My insomnia completely dropped. Overwhelmingly, I felt completely healthy from head to toe in a natural way because I was using nothing but tincture and edibles and smoking when it was needed.
They have to, one, have a desire to get off of it. And then we start to slowly wean them off. If they're at 100 milligrams a day, they start the tinctures, they're able to sleep and reduce their pain levels, and then they wean themselves off by reducing it by 10 milligrams each week. And after 10 weeks, they will be off those 100 milligrams of Oxycontin and just getting by with the tinctures. And those folks are no longer locked on the couch. They have a new, renewed outlook on life. They're starting to lose weight, and they then discard their diabetes medicine, their high blood pressure medicine. I have people who come to me with 7 or 8 different prescriptions, and slowly we nick away at them, and they get completely off of pharmaceuticals totally.
And here I am in July, standing before you, and I have since lost almost 40 pounds. I'm completely active. I've been able to backpack, canoe, kayak, and hike for the first time in 2 summers. I no longer deal with insomnia at all. My chronic pain, as long as I maintain the tincture every day, my chronic pain is now to a point where I don't even have to think about it. The only time I think about it is if I actually skip my tincture for about 3 or 4 days. So I am now on a natural regimen of tincture and some of the edibles. I've lost almost 40 pounds. I'm completely active. My depression is gone. My insomnia is gone. And I'm completely functional and able to advocate for the things that I've been doing with, like days like here. So it's been a wonderful experience. Anybody who is dealing with pharmaceuticals, whether it be for depression, whether it be for chronic pain, especially chronic pain, whether it be for post-traumatic stress syndrome, or even insomnia, any of those issues can be completely regulated by a completely natural drug.
Now, what you do may be considered controversial, and it's a state law in Maine and other states. Now, how many years are you facing with the federal laws that still say what you do is illegal?
Well, because it's a Schedule I drug, I face personally 20 years minimum mandatory, and being close to 60, that's pretty much a life sentence, and complete confiscation of all my assets because it's all intermingled. And so I don't take a salary. This is an art project for me. I want to prove that it's possible to do. We're not in it to become millionaires. We're in it because it's the right thing to do. And, fuck the pharmaceutical companies and fuck the government. And this is how we're helping people who are in our community. And we will overgrow them eventually.
I like that. You're risking your freedom. You're coming on camera, exposing what you do out in the open, and you're showing people how the way to go, the path to walk. You know, it's like, I can do it. I don't care. I'm helping people.
We are doing the best we can and trying to change hearts and minds, and that's all we're trying to do. And
I know when people hear about cannabis, the wall goes up. Oh, you're a pothead. I get that. But I'll be honest with you. I have cut my pot smoking at least by 2/3 since I have started the cannabis tincture and the edibles. My pot smoking for the pain has actually decreased dramatically. I don't smoke very often, only when I really need that immediate pain, but overwhelmingly, I really can't even mention the tincture enough, or the cannabis capsules, which I'm getting ready to try. I'm really excited about that. But the fact is that when you actually treat it, when you stop looking at it as a recreational pleasure, and you start looking at it as a medicinal measure to treat your ailments, everything changes for you. I went from recreational to medical, and my recreational use dropped and my medical increased, and I've never been healthier. So to say that people that would use it medicinally are just trying to smoke pot, actually the exact opposite ends up being true. People more focus on the medicinal aspects of it, and their recreational use of it tends to decrease because they find a much more effective way to be able to introduce the cannabinoids to their endocannabinoid system much more effectively medicinally, and it makes all the difference. And so I completely recommend that you would educate yourself on that issue and look into it a little further for your own personal well-being.
Thank you very much.
Thank you.
Rachel right here, real life story.
It's so heartening to find a patient who I didn't expect to run into just be so successful with their use of our cannabis. It is, people say, thank you for my life back, and that's my reward. You know, someone's got to do it, and that's me.
At this point in history, I say no pothead. If you're arrested just for marijuana, you should not be convicted at all in front of a jury, because we know that more than 50% of Americans believe that marijuana should be legal. On a jury of 12, that's 5 or 6, you know? And if that's what you argue, that the law is wrong, don't deny anything. The law's wrong, not me. Yes, I use marijuana. Yes, I'm going to use it at lunchtime. Yes, tomorrow morning, I'm a wake and baker. Yes, I'm going to smoke it. The law is wrong, and every one of you 12 people on the jury, you know the law is wrong.
Can I ask you a quick question? Sure. How do you feel on the medical marijuana issue in Connecticut?
Again, I am not working on the state issues right now.
Well, how are you going to prevent the feds from coming in, because it is a state law, and you know how federal law supersedes state law, and just like out in California and everywhere else that they passed it, the feds go in, they shut down the dispensaries, and these people can't get their medications. So what can we do to prevent that from happening?